Welcome back. We are very excited that you're here. It's nice to see folks in the industry. We're just thrilled to be here. My name is Carrie Fairnack. I'm with CNTV, and we are joined by several biosafety and medical experts who have been talking with us about masks. So even before I introduce them, I want to tell you what we've decided. Because I am socially distanced and the risk is very low, I'm going to take my mask off. However, these guys are going to leave their masks on unless they're actually talking. And so we think that's important to explain because during so many events, it's better to just address the elephant in the room and explain what we're doing. So we wanted to be clear about that. All right, let me introduce to you my panel. First, to my left is Mark Tester with the Orange County Convention Center. Mark, thanks so much for being with us. We have Patty Olinger, who's here with GBAC, which is a division of ISSA. Many of you I know ISSA, and Patty's the executive director. We have Mike Waterman from Visit Orlando. I know many of you know Mike. And joining us on the end, we have Dr. Antonio Crespo, who is the medical director for infectious disease department at Orlando Health. So let's give a warm welcome to our panel, please. Thank you. All right, we are going to start with our medical expert, Dr. Crespo. Dr. Crespo, tell us, kind of set the stage. Where are the numbers for COVID right now in Central Florida? Tell us how we're doing.
So thank you for having me here, and it's great event, and definitely it's good to see that we are reopening. So in terms of how the situation is, definitely we saw a big increase right after the Memorial Day weekend. We started to see a significant increase in the number of cases and patients getting admitted to the hospital and in all around Central Florida. Right now, the numbers for Orange County is about 25,000 cases, and 159 people have died from COVID-19. So that's about 1%, which is pretty much what we are seeing across the board in terms of mortality. It may even be a little lower, between 0.5 to 1%. Still a significant problem when you see the number of cases that we're seeing all across the state in the United States and still all around the world.
Thank you so much. I know it's important to remember that when we see the Florida numbers, it's across the state, right? So we have to keep in mind that in Central Florida, we should be looking at our numbers here in this area, which can be very different than South Florida, right?
It is all across the state. Definitely South Florida has the biggest share in the state, but we are seeing it all across the board.
Right, thank you, Dr. Crespo. Okay, so I'm, like I mentioned, a big fan of addressing the elephant in the room. So Mark, I want to talk with you for a moment. I know there are some folks who might be watching virtually especially, who might think this is too soon. You know, the numbers in Florida are still pretty high. Tell us why you think this is the right time for the Together Again Expo.
Well, the Orange County Convention Center, our tagline is we're the center of hospitality. Hospitality in our industry is the #1 job provider and so important to us. And we want to position ourselves as a leader, and leaders take risks. And someone needed to come out front, and we were very happy to do it. And of course, we had a lot of other people showing us the way. We met with the Florida Department of Health. They walked through our facility. They agreed with our plan, and then we got to see what the theme parks were doing, both Universal and SeaWorld, which opened over a month ago, and then Disney, which just opened last week. So we really had a lot of people that were plowing the way for us, and we believe that we're physical gatherings, and we can get together and control gatherings and do it in a safe way, and doing all the things that we need to do in order to be a safe facility.
And many of those things are on display here at the Orange County Convention Center, and we're going to walk through some of them. Patty, you have been front and center for so much of this with GBAC. Tell us a little bit about why the accreditation is so important and what it means for the center here specifically.
Sure. Can everybody hear me? All right. Whoa. So I'm going to show that you can talk with the mask on. But, you know, I am so happy and proud to be here with Mark and, you know, our Visit Orlando. It, you know, has been just an amazing journey to get here. So the Global Biorisk Advisory Council is a division of ISSA, and ISSA, the world leading trade association for the cleaning and professional disinfection communities. We launched GBEC Star in May, and Orange County the convention center was one of our first convention centers to be accredited. What they have done to put in place for your safety and for the safety of what we're doing to reopen has been phenomenal. United Services Companies, with Rick Simon's organization, supporting this convention as well, this expo. It's based on 20 elements. Those elements are quality management program elements. If you're familiar with it, you'll understand what it is. But we look at cleaning, disinfection, and infection prevention measures. And we look at things that what we can do with what you have, and maybe what you have isn't working or wouldn't work for our current situation. You need to do a risk assessment. And even things like, as what we talked about, if you're going to remove your mask, you know, how you do it safely and be able to put it back on, especially if you need to put back on and you've been out in public. And so, you know, we're here to support you. Please reach out. If you see me, go ahead and ask questions. But I really have to applaud the efforts. And Mark, you know, we've been doing all this virtually. I have not even met Mark until now. And so, and you know, just so happy to be here and to be here with you and support you and reopening the events and trade shows. So thank you very much.
And we're glad you're here, and we appreciate all the work that GBAC has been doing with venues around the country. And I know Orange County Convention Center was one of the first, which is fantastic. Mike, let's talk a little bit about how Visit Orlando is supporting clients. I know this partnership is one of those big things. Talk to us a little bit about that.
Yeah, thanks. Boy, it feels so good to be in a face-to-face meeting. I can tell you, and I'm sure talking to many of you out there today, this just accelerates the fact that nothing beats a face-to-face meeting. I cannot thank each of you all for being here today and showing really the country and arguably the globe that we can do this safely in the right way. So thank you so much. You know, we've been in constant contact with our client partners and our destination partners really about how Orlando and Central Florida is reopening and also what the entire region is doing from a safety protocol perspective. And it's truly remarkable. And we're doing that through, you know, all the traditional, we're doing webcasts, we do a Meetings Matter bi-monthly newsletter, we do social media, LinkedIn. And the goal is really to articulate to our clients and ultimately the attendees that you can come to Orlando, whether it's in a hotel or in the convention center, and do and conduct a safe meeting. And we announced recently really an industry first pioneering partnership with Orlando Health to offer a concierge medical service directly to those customers who are meeting in the convention center for the remainder of 2020. And it provides personal support, information on how to conduct a healthy meeting. They helped us for this meeting. They helped us with AAU last week. And it really has been a remarkable collaboration.
And we're going to dig into that partnership in a moment, but we want to let you know also that it's not just the center, right? There's a lot happening at the airport and the hotels because when clients come in, when attendees come in, they've got to see all parts of Central Florida, right, here in Orlando. So we want to take a look at what's happening at the Orlando International Airport. So let's watch this video with Kara Moore from CNTV.
At an airport usually buzzing with activity, Orlando International Airport these days is relatively quiet. The atmosphere may look a bit different. Masks are required, and airport staff will remind you of that. There are even vending machines to purchase masks if you don't have one. But you won't find long lines. Not at the airport counters, not at TSA screening points, not even to get your favorite cup of coffee. But what you will find is something you may not notice with the naked eye. You will find a thoroughly cleaned and disinfected airport.
We right now are in the process of going for the GBAC cleaning certification, the same one that the convention center is having. It has right now that accreditation, so we're doing that. But basically, we've ramped up all of our cleaning.
Cleaning crews at Orlando International Airport are certainly not new, but their procedures since the COVID-19 outbreak are pretty different. They're focused more on high-touch areas like elevators, escalators, around ticket counters, and touch screens.
We have procured the electrostatic sprayers, the foggers. So you see day to day, you see probably more cleaning folks out now around the touch points. We have our staff out cleaning touch point areas, as well as providing information. The big cleaning takes place here at the airport. It's in the middle of the night. That's when everyone comes out with all the equipment and the machines. And then we do the electrostatic spraying, and we make sure that everything is disinfected and everything is clean and it's ready to go for the next day for everyone to enjoy.
And more people appear to be doing just that. Passenger traffic at Orlando International Airport doubled in the month of May over the previous month. More than 214,000 more passengers flew in May than in April from MCO.
So you start to see that, and you start to see more people now getting here a little earlier and sitting around and enjoying the facility, and they don't look as tense, they look a little calmer. So I think that we're stepping in the right direction here.
The uptick in passenger traffic is welcome news for an airport typically ranked one of the busiest in the country. The message from airport leaders in Orlando, that is clear.
You couldn't pick a better time to travel right now. And right now the internationals are trying to get back into operation as best as they can. Right now, Aeromexico is back with us. JetBlue and Southwest are flying international. And we have others that are trying to do that as well.
So come to Orlando.
We're ready. We're ready. The facility's ready. Yeah, we've been ready.
I'm Kara Moore with CNTV.
So, Patty, Tom Draper in that piece mentioned the GBAC accreditation. Tell us who all can apply for that and how the process works.
It's been very interesting because there isn't a type of facility that, every time I say that, then a new type of facility reaches out to me. But we've had convention centers, arenas, the Miami Dolphins, the Hard Rock Stadium. We've had hotels, Hyatt hotels, leading hotels of the world, and the small luxury hotels of the world are chains that have signed up, and just little mom and pops. We have the first restaurant that just got accredited in Dallas, Texas. We've had churches, schools. Obviously, schools are huge right now, and there's a lot of questions on what to do. We now have service providers that are begging to have something, and we're going to be rolling out in the next 30 days our service provider program. So we haven't found a facility type, whether it's a salon or a spa or really anything. So anybody can apply, because the 20 elements really are, I'll call generic from a standpoint of they can be scalable and they can be applied to any type of venue. But I think what Orange County has done, what Visit Orlando has done, is shown how a community can come together and collaborate to be able to show that they are ready to reopen as a community for people to visit. And with the airport, one of the things that like Visit Orlando had indicated, and other venues or other cities, was that they wanted people to realize that when they come to the city, they get on an airplane. American Airlines is now going to be an accredited airline, and we're working with them. You get on an airplane and they see the star, and they get in the airport and they see the star, and then they have a transport to wherever they're going to be, and that they have that confidence that people are taking care of them, and that they have put in place the elements that need to be there so that they can reopen their lives and get back to whatever normal is going to be.
Great. No, that's great. Thank you for letting us know that. And I know, Mike, you guys are also talking specifically with folks who may not be here in Florida, right? Tell us a little bit about the messaging to groups and clients who want to come to Central Florida.
Yeah, we know people's desire to travel, whether it's for business or for leisure, is predicated on their belief that they're going to come and have a safe experience. And really, we feel our role is to communicate as much as we possibly can to build that confidence. So we're using newsletters, we're doing webcasts. Our website, visitorlando.com, has a help hub, which gives clear direction on what our industry, what our market is doing, the hotels, the attractions, the restaurants. and really paints the picture on how you could come to Orlando as a visitor and have a great experience. Look, Orlando has some of the most trusted brands on the planet. We take safety seriously. We have been doing that for years. We know how to handle large volumes of visitors, and we look forward to continuing to share the message that you can come and experience Orlando. Do it safely, and most importantly, you can enjoy the experience.
You mentioned hotels, right? We would be remiss if we didn't talk about what the major hotels are doing as a part of getting back to business events here in Orlando. Let's take a look at another video by Kara Moore with CNTV.
Orlando area hotels, usually buzzing with tourists and business travelers, are getting used to a new normal.
A lot has changed in the industry. We're certainly living in different times.
Large hotels like the Rosen Center and Hyatt are becoming experts in the latest cleaning and sanitation technologies. For the Rosen Hotel Group, that meant tapping into its internal medical resources to put together a COVID-related task force, a think tank of sorts to determine the best policies and procedures for guests and employees. And guests will see the changes immediately.
When you enter the building, we're met by one of our staff members who meet and greet you, welcome you to the property, and then you are asked to walk through a thermo-infrared machine that reads your temperature. It's harmless. You basically put your wrist up to the machine and it takes your temperature.
Hotel employees at both the Rosen Center and Hyatt are also temperature screened.
Temperature normal.
Electrostatic sprayers are now virtually everywhere. These handheld machines are used to clean common areas, in some places even guest rooms, with the cleaning mist wrapping around surfaces and sanitizing them within 45 seconds. Housekeeping staff has also been retrained, instructed to clean and then sanitize all frequent touch points. At the Hyatt, those new protocols come from a newly created role.
Globally, we've added a new position for every property. It's a hygiene and well-being leader. And in that role, that person's responsibility is to train and learn all of the aspects of proper cleaning and sanitizing, and then relaying that information to every employee before they come back to work.
Following in the footsteps of the Orange County Convention Center, the Hyatt has begun an accreditation process with GBAC, the Global Risk Advisory Council, to ensure the new cleaning and sanitizing protocols are strictly followed. Guests will notice social distancing markers in hotel lobbies, in elevators, which are now limited to only a few people, and even in meeting spaces, where capacity is often limited and furniture cleaned between each meeting or session. The hope is these new procedures will drive more people to fill these lobbies once again, comfortable in the fact that hotels are safe.
We just had a customer stay with us for a week because they're hosting an event later in the year, and they wanted to see it. They wanted to see firsthand what we're doing. They wanted to experience it, be comfortable with it, and the reviews were amazing.
So it's important that people understand that business is going on and that there are policies and protocols in place to ensure their safety, and that we are collectively as a group, as an International Drive Business District, looking forward to conducting additional business as we move forward.
I'm Kara Moore with CNTV.
So I know we're all looking forward to having those hotels filled again, right? Mark, let's talk about some of the larger clients, the larger shows that come. What's a specific challenge for a show that may have more than, say, 10,000 attendees or something?
I think the first thing is how they're going to lay out their educational program differently. Right now, we're mandating that ballrooms and meeting rooms be set up to 50% occupancy, and so therefore, you're going to have to take a look at your educational program differently. Customers are thinking of popular general sessions. Are they going to do them both in the AM and the PM? Are they going to live stream them so that people can watch them in other areas of the building? Certainly the trade show floor is different. One-way aisles, wider aisles, looking at staggering attendance from literally the first part of the alphabet in the AM, the second part of the alphabet in the PM. And we're sitting down with each customer to figure out what makes the most sense for them. Certainly, temperature taking is something that everyone has been discussing right now, and what other safety measures that they want. Do they want to have medical professionals on site with a quarantine room in case someone does feel bad, and what will they go from there if in fact someone does feel ill?
That's a good point. I know for so many trade shows and education conferences, the key part is really networking, right? And so much of that happens in very close quarters. Patty, can you tell us what some of the alternatives might be for the traditional networking reception that we're all used to going to?
Yeah, you know, I love the little booths out here where they have set up where people can sit and talk to each other, but they're still, and I think that what we'll see is some very innovative things that are coming forward. You know, the way that, you know, we have things spaced in those round tables where you're farther away from one another, being able to wear your mask, paying attention to washing your hands often, the hand sanitization, all of these aspects that a convention center like Orange County is putting in place are those types of things that will help us be able to continue to have that. The education sessions can still happen. You know, we're wearing our masks. We're paying very close attention to those infection, you know, prevention measures, infection control measures. And so working together, we'll be able to reopen and get these things back in place.
You mentioned masks. One of the things, the reason I'm a big mask wearer all the time, I'm leaving it off because I'm asking questions over and over, and they said that actually there is a danger in taking it off and putting it back on over and over. And so I think that's important to remember whenever we're at events, right? These are the kinds of things that we can educate attendees about. Let's hear from one of the larger customers here at Orange County Convention Center. We had a chance to catch up with Alice Mathu from IAAPA. Let's listen to what she had to say about planning her event here.
We do work with our committees since we're a member association, so we get feedback from manufacturers and supply committees as well as our executive and board committees that helps guide and direct our decision to still host the show in November. So we are excited to see our members again in November. So we have worked with everyone from the Orange County Convention Center, Visit Orlando, Freeman, who's our decorator, to the hotels to make sure that the health and safety guidelines are well established and communicated to our attendees. We also have sent out surveys to some of our loyal attendees as well as exhibitors to find out what's front and center of their minds, what would be the hindrances that would make them not come to the show in November. We also constantly communicate via social media circles, push out information on our website as well, and have a team that's readily available to answer any questions or concerns people might have.
We're excited about IAAPA being back in this building in just a few short months, which will be great. Dr. Crespo, let me come to you. I know that the partnership with Orlando Health has been mentioned multiple times. Tell us a little bit about, in reality, what that will look like. What is composed of that? What happens?
So something that in Orlando Health we realized early on is that COVID-19 is going to be a long process, and that we have to learn how to live with COVID. That's how we call it. So part of that is once the community had to reopen to go back, and the business community had to go back, we felt that we had a responsibility with the community to work together in that process, and to use the experience that we had built in the hospital taking care of patients with COVID-19 to, again, help our community partners to do this safely. So we created a group, a task force dedicated to that, and we've been working with different business partners in the community, from theme parks to sports teams, schools, churches, with your team, with the convention center. We have helped to bring the AAU sports event here. Basically, what we do is we provide support all along the process. We have a website called Business Ready that you guys can check. and get information. There are videos from experts about what to do in terms of social distancing, hand hygiene, wearing masks, cleaning surfaces, what to do when somebody gets ill. We actually go and visit the place. Sometimes I have gone myself to places and just go over the process, how they're planning to do it. So it is done in a safely manner. And once the event happens, for example, the AAU, we are available to provide support, virtual visits if it's necessary, what to do if somebody comes positive. So that's the type of concierge service that we are providing to our community.
Partnership allows for constant 24/7 phone calls with somebody from Orlando Health, right? Mike, tell us a little bit more about why show organizers can be so comfortable knowing that partnership exists with Orlando Health.
Yeah, we knew we along with our partners at the Orange County Convention Center are really good at tourism and business and holding conventions, but our wheelhouse is not being a medical expert. So we knew partnering with Orlando Health and interjecting that professional certified medical component where our planners who are candidly begging for it could have a dedicated resource, medical professional that they can ask questions about how do we physical distance or social distance, how do we do temperature checks, if somebody gets sick, what do we do, or calls in a temperature above 100.4. And we were not that entity. We couldn't provide that, but we knew, and it's really remarkable what Orlando Health has offered for our clients, access to PPE, this 24-hour chat live function. So, if you had a question today, you could go onto this web chat and ask a question and get an immediate response 24/7. So it really is, like I said earlier, it's about providing the expertise and really ultimately the confidence of a planner, and more importantly, or as importantly, an attendee to feel comfortable to leave their home and come to Orlando for a meeting or convention.
Well, and for our virtual audience, just so you guys know out there, we all had our temperature checked. I had mine checked twice, once outside and once inside, and we have these stickers that say I'm cool, which is kind of cool, and a good way to know that everybody around here has been checked. Mark, I think this question is for you. What happens if someone has a fever? What happens to them if someone's at an event?
Well, we are advising customers to have a quarantine area where they can take them and get a better, more accurate temperature check with a more traditional device. Also, Orlando Health has a virtual component where they can literally get online and get on in conversation with a doctor and make decisions on where they're going to go. And luckily, Orlando Health just has a facility just literally about a mile or so from here that they can get to and get the proper attention just about right away.
Which I know this partnership is very unique, first of its kind in the country, I believe, and I think that is something that's really important for folks who might be bringing their events to Orange County Convention Center and Orlando in general to know. I know you all, in addition to the GBAC accreditation, also are following the guidelines put together by the task force with IAE taking the lead. I know David Dubois is here as well, working with multiple associations. So we want to hear from Tim McGinnis, who led the task force to put together those guidelines. Let's listen in to what Tim had to say.
A group of us got together and wanted to, begin the preparation process for opening events and trade shows because we knew that we were significantly impacted and we had to put something together. And that was the next step as far as making sure that we were providing specific documentations for folks. So there was a task force of individuals that we all got together, starting to having an open dialogue as far as what was needed to be done for this. And then what we did is we engaged other organizations. We engaged folks like from CISO, ESCA, EDPA, the International Association of Venue Managers. So they collaborated with our task force group to have input and provide their thoughts, opinions, ideas regarding what should be put into the document.
And You know, Tim mentioned this collaboration, right? Mike, this is a unique time for all of us, I think, and it seems like that kind of collaboration is really key, right?
Yeah, look, I've worked, actually started my career here a little over 30 years ago. Mark and I have known each other for almost 29 years, and I've worked for Marriott for 26 years. I've lived and worked almost all over the country. Orlando has something special, right? The partnership and the collaboration with our hotel partners, our clients, the center, Visit Orlando, it really is a magical deal. I kiddingly say, you know, everybody in this city, whether you're a dry cleaner, a florist, or a hotel, you understand the value of tourism and visitors. It's in our DNA. Hospitality is in our DNA. You know, we're globally recognized for it. So it is more important now than ever that we continue to work together. You know, we're only as good as our weakest part. So we got to make sure everybody's on the same page and everybody's doing everything they can to ensure that your visit is safe, and I'm going to reiterate this, but also enjoyable, right? Has to be safe, but it has to be enjoyable. Otherwise, why would you bother coming?
You mentioned the Orlando Health Hospital right down the road, right? Dr. Crespo, tell us what you're seeing at the hospitals now. Catch us up a little bit on how things are going right now.
So I'm part of the infectious diseases team, and we've been taking care of patients with COVID-19 since mid-March, when we saw the first patient here in Central Florida. We started to prepare since January, as soon as we learned about COVID-19 being a problem in China. So we basically have been taking care of our patients, but also be sure that we protect our healthcare workers from getting infected. So it's a process that we have to diagnose the disease, so we have to provide the proper testing. We have some treatment options that we can offer to them, but then we have to be sure that we have the proper supply of protective equipment and that we use it judiciously and provided the best support to our team. And I think so far we have provided, we have achieved that. As I said before, this is a long process. This is a marathon. It is tough on all of us. I think that the staff, the doctors, the nurses, the respiratory therapists, the environmental services, the administration, everybody that is involved on this, it is taking a big toll on us. But we are strong, we are resilient. We're here to help our community, and we wake up every day with the goal of helping and try to provide the best possible care. So our patients are most of the patients, they do well. Unfortunately, some of them succumb to the disease, but and some of them have a prolonged course, but patients tend to recover. It is a tough disease. It is a tough disease.
Well, we appreciate what you're doing for the community. Thank you from all of us. Patty, let's talk a little bit more detail about GBAC, right? We all know about the masks, the overall sanitation, physical distancing. Tell us what the center specifically has to go through, as well as other venues to be accredited. What are some of the more detailed things?
So first, I'd like to say Orlando really is showing leadership in a way that other communities are starting to follow. But the relationship with the medical team here and was the first that really had that type of relationship. And your mayor has been amazing in the support for the convention center and the city. It's just been, you know, hats off to you here in Orlando. The accreditation program is actually, it's a process and it's a collaboration. It's not a, you know, pass or fail or anything like that. We're here to work with the facilities to help them go through their whole program. So everything from like the 20 elements will have things like a commitment statement. Do you have a commitment statement from senior leadership? We look at SOPs. What type of SOPs do you have in place? For COVID-19, after they've done a risk assessment, and right now, obviously, SARS-CoV-2 is what everybody is focused on. Do you have the right chemistry or disinfectants and cleaners to be put in place? And some people don't understand what that means. You know, do you have the right equipment? You've heard electrostatic sprayers, you've heard foggers, you've heard, you know, there are a lot of different pieces of equipment that are out there, and we help them go through that process of, you know, is this applicable and is it appropriate for what they're trying to accomplish? And then making sure, and it was so funny, and actually I think here in Orange County we ran into this. I talk about the program must be sustainable, and immediately everybody thought it was green. And you know, I was a former head of environmental health and safety and very environmentally conscious. And it's like, you know what, it can be green, but what we're looking at is we want to make sure that whatever you put in place can still be done tomorrow and a year from now and 2 years from now. This program needs to be sustainable because right now we're dealing with SARS-CoV-2 and COVID-19 as the disease, but tomorrow it could be something else. And what we do for SARS-CoV-2 can be applicable to the flu or norovirus or something else. And so we want it to be sustainable. And yes, the PPEs, there are several different elements about part of it.
This is really a long game, right? It's a little terrifying to hear you say there might be something else. I'm not going to lie, right? Let's try and get through COVID first, right? But I appreciate the idea that it really does have to be sustainable, and it is for the long game. This isn't just something to do immediately so you get the star, right? I think that's really key. Absolutely. I know before I did this panel, I asked a couple of other show organizers that I know what questions they had, right? And one of their questions was about enforcing some of these rules, right? So if a show organizer is here and they're having their event, Mike, Mark, I don't know who wants to take that one, but what kinds of things will be done to really ensure that folks are wearing their masks, that the temperatures are being checked? What kind of enforcement might there be? Mark, you want to take that one?
Well, really, it is a partnership with the event, and they have to take ownership and working with Orlando Health and other providers, making sure that they develop a plan that fits their needs. And making sure that we are controlling access so that people can come in and do it quickly and efficiently, but get their temperature taken, get in and start their networking and moving along. And so it really is a partnership. It's something that we have to, the show has to buy into it as well as we do. But if you just look around today, you know, everyone's been wearing a mask. I don't think we've had to have any enforcement. I think everybody realizes the importance of being safe at this time, and hopefully that will continue until, you know, there is a vaccine or something else that can, let us relax. But the GBAC Star accreditation is a long game. I definitely believe in that, and definitely believe that safety and sanitation from an event venue point of view has changed and will continue to change, and will be a focus for venue operators to ensure that everything is safe. I think one of the things you'll see even today is normally our housekeeping staff, which we call environmental services, are more behind the scenes. And they're much more out, much more present, much more wiping down areas, especially those high touch areas, so that people feel more comfortable. Yep, that's clean, I feel good, and that comfort is much more readily available for people to realize that they're in a safe environment.
And you know, let's talk about the event that just happened. Mike, tell us a little bit more detail about AAU, how it went. I think a lot of folks want to know that, you know, that was one of the first events back here in the building in Orlando.
Yeah, it was remarkable. I was there a couple days, took some amazing pictures. We had, you know, close to 12,000 folks in the north-south building across the street. Everybody was wearing a mask. Everybody was temperature checked going in, one way in, one way out. You know, it was magical for us to see the parents and the coaches and the kids actually having a real live. You know, these kids have been practicing and training for months for this tournament, and you know, huge credit to Dr. Gowdy and AAU for having the courage to kind of be the first. I know that wasn't easy, but it was remarkable. And I think we're also sort of fortunate to be in Orange County with an unbelievable leader in Mayor Demings, who you saw this morning. You know, we've had a mask ordinance in place for almost 5 weeks now. So this, you know, wearing a mask is comfortable because we've been doing it for 5 months. And I think that helps with the sort of assurance that people are going to wear a mask. And candidly, I've been walking around, since I got here at about 9:30 this morning, and I feel more comfortable here than I do necessarily walking through my grocery store. So because we're social distancing, because everybody has a mask on, I think it's really, proof that we can and we have to, right? This is our livelihood, our business. We have to figure out, all of us in this room have to figure out how to do this to have our business, restart.
It's interesting. This is one of the first times sitting here that I have not had my mask on. I almost feel like I'm missing something. I mean, you really do get used to it after a while, and I think it's so important, right? Dr. Crespo, what do you see as one of the biggest risks? What should people really be looking out for? I mean, I agree that I feel safer here than I did maybe at IKEA, not to name names, but at some big place. We're here, everybody is here for the same cause. We're all sort of in it together. What is the biggest risk? What should we be looking out for?
So the biggest risk is when you are in a closed space, people are not wearing masks, and one of them could be an asymptomatic carrier of the disease that doesn't know has the disease, but already can transmit it to the others. So that is the biggest risk. That could be in a gathering, in a house, it could be in an office space, it could be in a sports event that is closed, in a closed space, indoors. So any place, as long as if there is a concern about keeping the social distance, and then you need to wear a mask. And that's what we're seeing. We're seeing a lot of cases when teenagers or young adults go out to a gathering, to a party, and then maybe not all of them follow the precautions, and then they find out that one of them had the disease, and then a lot of them had the disease. They go to the houses, and then the parents and grandparents get it as well. And those are the patients that we see in the hospital over and over again. It could also be people going out to work and getting exposed at work, and the same thing. So I think that is the biggest risk. If you are in a closed space with a lot of people, or more than 2 people, and you need to wear a mask, otherwise there is a potential risk of exposure.
Our industry, right? That is hard. We're used to hugging, we're used to high-fiving, we're used to handshaking, we're used to networking. So I know that can be a challenge in the industry, but it is interesting to hear that the biggest risk is when we're in small groups with each other, right? And so that's when we need to really kind of watch out. I would love to talk just for a moment about how important it is that all of us advocate for our industry too, right? First, safety, of course, but then also getting back to the business of things. And I know you guys have all been involved in that, and we're going to hear from industry leaders this afternoon about that. But tell me, Mark, how important you think it is that we all advocate for the business events industry.
Just seeing everybody here just reminds me, and it has never escaped me, how much I enjoy face-to-face events. I see old friends, I meet new friends. It's just so important. I know that we're going to be supporting our industry associations. IAE, Expo, the Orange County Convention Center will absolutely be there. Professional Convention Management Association in January, their convening leaders will absolutely be there. And they're going to be a tremendous value for us as we reconnect. And as I've told people, how much do we have to talk about right now? How many struggles, how many challenges, how many opportunities we've all faced. And there's going to be so much that we have to share. But we all have to do that out in our communities too, make people understand and the reality of what our industry means and how important adult education and adult learning is for every industry. A lot of people have those initials at the end of their names, those professional titles, and the best place and the easiest place is to get them at face-to-face events. So it is so important. And we all need to advocate, and I think we all do in this room, but we also need to talk to our elected officials and make sure that our elected officials here in every little community across this country. Mike and I are very blessed that we have a community here that understands tourism, but we're at the table. Our mayor, Jerry Demings, has an executive policy group that he has calls every single day. I mean, every single day. Where he leads, and there are people from the community, from all aspects of our community are on that call, and he calls on the convention center every single day and asks them what is going on, what do we need to do, in order to be safe. And so that's important, and we need to make sure all of our elected officials know how important our industry is and how we need to get back and how they need to support us so that we're back to 100% sooner rather than later.
I agree 100%. I think that's on the local level, the state level, and the national level. I hosted Exhibitions Day in June, and we normally go to Capitol Hill and meet with members of Congress. This year we did it virtually, but we had more than 650 people virtually sign up for that. Normally on a Hill Day, we might have 150, right? And so to me, that was really inspiring because I think people know now that they've got to get involved, whether it's Exhibitions Mean Business, Go Live Together, Coalition. This is how we're going to move the industry forward, right? So let's go back to safety. I'd like to hear just a final thought from our safety experts, our medical experts. Patty, do you want to start with a final thought on how we can all get back to business and what we should be focused on?
Sure, I think what you had just said, some of the elements of that is that we can do this, but it's going to take some behaviors different. You know, looking out in the audience and seeing everybody have a mask gives people a confidence that, okay, I'm safe to be here. Walking through the convention center and seeing the attention to detail that the Orange County Convention Center and the United Service Company has put in place to be able to have the alcohol hand sanitizers, somebody wiping off the escalator handrails. We're seeing that attention to detail. But at the end of the day, it's our behaviors that's going to allow us to be able to come forward sooner than later. And until we do that as a community, that's where it starts having some problems. So as a community, as Orlando really has done, you know, we can do this safely and together.
I'm glad you gave a shout out to United Services, the folks who are doing the cleaning. Rick Simon was going to be on our panel at one time, and Rick's company is doing a fantastic job at convention centers and the airports at actually really making all of this happen. Patty, thank you. Dr. Crespo, any final thoughts from you?
So I think at this point, probably we all know how we can protect each other from getting COVID-19. So be sure that we have to resume activities. We have to do things that we have always done. Be sure that you do it on a safely manner. Be sure that you follow the advice of the experts, that you look for help if you need it. And remember, keeping the distance. If you can't, wear a mask. Clean your hands. Clean surfaces frequently. And the most important of all is if you have symptoms, if you are sick, stay home. Don't go to school, don't go to work, don't go to any place when you can contaminate somebody else. That's how we can control this disease.
Very good point and good reminders for all of us. And I know we can use this event also, especially for folks who put on events, as an example, right? I mean, one thing that we were talking about was a lot of the folks in the videos were originally going to be on the panel, but we couldn't space out enough for the panel, so instead we decided at CNTV we put them in videos, right? So these are things that we need to do differently than maybe we've done in the past. Mike, Mark, some final thoughts? Mike, we'll start with you.
Yeah, look, I think, you know, Orlando has historically been and enjoys being sort of the lead dog, as Mark said earlier, whether it's, you know, welcoming tourists or major conventions to Orlando. We like that spot. We actually love that spot. And we're so grateful for all you being here today. Like I said earlier, the country, maybe the world, is looking at this as a proof point. The good news is we're filming it, we're capturing it, we'll be able to share that to those folks who weren't able to come here today. But you know, we have to get this thing on the rails and back on the track. And we couldn't do it without you showing up here today. Again, eternally grateful. We look forward to figuring this out together.
Agree. Mark, some final thoughts from you?
You know, I'd really like to thank Alliance Nationwide Expo and Mark Yuska for his vision for this event and getting people back together again. And it's just so valuable. And I hope that each of us make a key contact that is going to add to our business, that is help us do our business back together. And I really even hope that, you know, I've heard that maybe Mark brings this on the road again and does this event elsewhere in the country. And and I'd love to be part of that as it moves forward, and just getting back together, making those key relationships, talking about it, implementing our business, and moving forward towards future success.
You mentioned Alliance Exposition. I also would like to thank them, as well as Techniche Creative, who's doing all the producing here. So we appreciate that. Everyone's focused on safety, and at the end of the day, we want to get back together again, right? So thank you all very much for being with us. Will you help me thank the panel, please? Thank you. All right, everybody, have a safe afternoon. Make sure to visit the booths, and there's more education to come. Thank you.